Good morning. I'm Deb Trautman. I'm the newly appointed CEO for the American Association of Colleges of Nursing, and I'm pleased to join you today to participate in what has been a very robust conversation that we're having and critically important to our nation's efforts to move forward in improving health and health care for all individuals. While I'm new to my role at AACN, 4 months this month, I'm not new to the idea and the importance of interprofessional education and practice. I previously come from Hopkins, and my colleagues there, like many across the country, we're working to strengthen opportunities to bring education and practice together, because that's a critical step as we think about how we measure the effectiveness of interprofessional education and practice, but most importantly, a very critical step to think about the final outcome, if we will, which is improving health and healthcare across the nation. I, too, welcome and am excited about the work that the committee has already done and the work ahead of you. I think that as we have talked about in conferences that we've held across the country, we talked about in classrooms and some of our publications, we have seen that we have made great strides in improvement in an understanding of what interprofessional education and practice is. We have implemented new strategies to promote, but we don't yet know what the most effective strategies are. So a part of the work, I believe, needs to be that we continue to assess and we continue to bring evidence to bear on what are the strategies that will allow us to achieve the best outcomes. As many of you are familiar, in 2011, the landmark report set out the core competencies for interprofessional collaborative practice, but it talked about team-based competencies. And I'm not sure how familiar many of you may be, but a document that we brought copies of in the back and would recommend to the committee for consideration as well was developed by Dr. Joanne Dish, and it's entitled Teamwork and Collaboration, a Competency Resource Paper. And it provides a good foundation for looking at what we already know, and then again reinforces the importance of developing metrics. As we move forward in every circle, in the policy world, the practice world, and the education community, increasingly more we're all challenged to demonstrate the value of our actions. And I think that this report will lay a great foundation for doing so. So I believe that we've heard from our colleagues here, and I would support that this is critically important work. I'm happy to be a part of it, and I think that I look forward to working with you all and others. We've heard some important principles, and that is about thinking about the broad community engagement, the evidence that we bring to bear on not only are our teaching strategies effective, but when we've been successful in implementing these teaching strategies, what are our graduates doing different? And ultimately, at the end of the day, it's for the individual who's consuming or consuming healthcare or the benefit of our larger activities, which in fact would put us in a position where we don't need to consume healthcare. So I think that the opportunity for interprofessional education and practice to advance and move us forward on what many of us refer to as the triple aim, improving the experience of care, the health of populations, and reducing per capita cost, I think that it is very, we are right on the cusp now of moving forward, and we have data that we can now look at that gives us a better sense and direction. So I would urge to continue to work on developing the metrics, because it will be critically important for us to identify and how do we may not be able to isolate the impact of IPE alone, but as we can show, for example, as we've done with magnet hospitals, looking at when there is a higher functioning team, there are better outcomes that are achieved. So we need to continue more work along those lines. Thank you for the opportunity to comment and to be a supporter.